Okay. Thank you so much, Ruth, for my presentation. I really appreciate it. I also want to acknowledge your effort to be a chair of this session and all the emails that you sent to us. So thank you so much. You were very kind to us. I also like to acknowledge Timon for the support, technical support, because we need it. Okay, so thank you so much for being here. My main research is on oncology because I work many years on oncology, but I also work many years in critical care. So I have done my PhD on oncology, and then I decided, was I trying to see what next? I do the postdoc also in oncology, and what I was teaching my students, because I also teach critical care, and I say, wow, we don't have nothing about critical care and spirituality. Because even today and yesterday, most of the research that we have is oncology, palliative care, nursing homes, end of life. So then I decided in the past 2 years to do my research also in oncology. Of course, I continue to research on oncology, but then I decided now to do a bit of research, bit by bit, in critical care and spirituality. So today I'm presenting here CPR of spiritual care in critical ill patients. It's a quick guideline that I'm presenting. Just let you know, it's in the beginning. I need to mature much more regarding this quick guideline. It's the first time that I'm presenting. So I really appreciate the feedback of all of you. And this research is also with Susana Miguel and Filipe Veludo, that also are from Catholic University. So when we think about critical care, perhaps the first word that comes to mind, it's complexity, isn't it? Complexity regarding the environment, because it's a very dynamic, a very hardworking environment that we have in this setting. Also, we have very technological interventions. The patient needs a lot of attention from ours, and also they need continued monitoring, continuing also rapid decision making, because they are very seriously ill, and it's quite a complex environment because we have complex patients, isn't it? So also here in intensive care, we have a high specialized domain, and we also need a multidisciplinary approach. I'm a nurse, but also have physicians, social assistants, nutrition, psychologists, chaplains. We need all a set of team, okay, to provide this collaborative also care of this type of patients in intensive care. So when we think about intensive care, we can say that we have a complex interplay of advancement treatments, very complex, also patient vulnerability, which they are, and also here we need to have a very rapid decision making to the patients. And also here that we lack here in critical care, we don't have a lot of spiritual care frameworks. I don't know any. I know from to oncology, palliative care, but frameworks in intensive care regarding spiritual care, we don't have it. So that's why perhaps was the main focus of my research. So as I already say, here in intensive care, it's a very high technological environment regarding critical care. And of course, in the past few years, I think we have made a huge effort to humanize critical care, but also all type of cares in nursing practice. So we need to humanize this care. And after all, we need here to reinforce that the patient is the center of our attention here. We don't need to see the patient that is connected to a ventilator or is connected to a cardiac monitor. We need to see the patient in the whole perspective as a person, okay? And sometimes in intensive care, we look too much at the machine response, and sometimes we don't look at the response of the patients. Because some patients in critical care, they can communicate and they are conscious. Not all are sedated, you know. Okay, so here I think we need to make a huge effort to humanize critical care, and I think spirituality is one of the approaches that we can do it. Of course, this is a very difficult context because some of the patients fight for their life and some of them are in the end of life. But we know there's a very high mortality rate in critical care. We know it, it's a reality. And then some patients deal here with a profound, sometimes they feel some discomfort because they start to think about their fragility as a person. They start to think about the finitude of life because it could be the end. And most of case, they start to have some existential suffering because they start to think, what is my meaning in life? What will happen? Will I die? If I recover, how will be my life? Because most of the patients that recover from critical care has a high morbidities, and they sometimes have the intensive care syndrome. They live with a lot of disabilities, and it's very difficult for them, okay? So here, you know, of being a critical care patient, he has a lot of damage in our body, physical body, to be in critical care. You lose body index, you lose the mobility, also emotional suffering, psychological suffering, social suffering. But sometimes we forget the spiritual suffering, and sometimes this kind of suffering that they have regarding the existential issues is more damaging sometimes than the physical damage that they have of being a critical patient. And it's quite the studies. This is a study from Spain, very interesting. And it's also important not only consider the patient, but the families in critical care. And here, this is a very interesting study from Spain, is Torrejo. She also investigates spirituality in the critical care. And they say that about 70% of the families feel spiritual suffering, relatives of patients that are intensive care. Of course, the patients, it's a less percentages because some of them are sedated and cannot speak, but it is quite a huge percentage that we have 70% of families have spiritual suffering and 60% of the patients also have. So we need to address this problem because it's really high. And sometimes you only think in patients in palliative care, how they have spiritual suffering, but in critical care, they also have spiritual suffering. So we need to address. So we need to address to recognize that the patients have spiritual needs and also families have spiritual needs because you have to think both, okay? And we need to assess these spiritual needs and to provide spiritual care to them, okay? First, we have to assess. Of course, with the assessment, we need to provide spiritual care. Also, it's important to have a very therapeutic intervention with families and patients, and it's very important to address the spiritual needs because it will improve the quality of care in critical care. Because most of the patients here, it's also a study in critical care that 70% of the patients and families would have spiritual care. In critical care, they say that's improve the satisfaction of the care and also the quality of care. So we need to address this topic. I know that in clinical practice is not easy. We don't have sometimes lack of time. Also in some critical care, it's an open space. Sometimes you don't have the privacy to approach because it's a very private topic. Also, in nursing curricula, in Portugal, we are trying to improve, but we have not addressed in nursing curricula this topic, only sometimes in palliative care or in oncology, but in critical care, we don't address this topic, so we need to change nursing curricula. And sometimes I think people misconfuse spirituality and religion. They are different topics, okay? And sometimes I think it's still a very difficult topic, very personal topic. And sometimes you can say it's a bit a taboo, even in Portugal, because in Portugal we are quite religious. But sometimes it's difficult for us to understand the spiritual dimension. So I have to move forward. So what was my main goal here? To develop a concise and evidence-based guideline integrating spiritual care in critical ill patients. So I developed this quick guideline to use at the bedside in critical care. So to develop this framework, I have conducted a narrative literature in electronic databases and also incorporated frameworks. And also I have a reflexive process to bring this quick guideline regarding spiritual care. So I bring this mnemonic when I was trying to arrange a catchy guideline, what kind of words. So I reach with CPR because CPR is a very common word in critical care. And I think this is a very quick guideline and catchy just to the people in clinical practice to remember. So the C is for comfort and connection. Here, connections plays a very important role regarding dignity, and also it's important to hear the patients' voices and their families. Even some patients are still able to communicate even when they are in sedation. It's possible. And I think we have here to have compassion, communication, and connection to the patient. It's also it's quite interesting here that we can have this connection in order also to have a more sense of proximity with the family and relatives, and here just to not to have such a so technical environment. Also spiritual comfort is important here, especially that people that are end of life. So here we can also provide hope, meaning in life, and respect their values and dignity in order here to have a more holistic approach to patients. Here, a presence, already talked about presence this morning. I think being there, have an active listening to patients and relatives, it's quite important. Have a therapeutic communication and also being there for them. Let them know that we are there for them. And of course, we can have many spiritual practice regarding holistic care. We can have a prayer, meditation, and also start to have a meaning therapy, and also we can facilitate this spiritual practice in critical care. Resources, we have a lot of resources regarding here spiritual care. And also here I want to highlight, it's important to include the chaplains here in the multi-professional healthcare team. Sometimes in some models, some frameworks, we don't recognize the importance of the chaplains, but I do. And I think they should be involved as a professional healthcare team and be involved in spiritual care for these patients. So at the end, this quick guideline, I think it's quite interesting because it offers, I think, concise, and I need to develop more, and I don't have time to explain everything. But I think it's this quick guideline with CPR, with the main key points of spiritual care, will be an interesting framework, especially for the healthcare professionals, and I think the patients and the families will benefit from it. So because I don't have many time, I have to conclude. So I can say that spirituality plays a significant role, especially in patients and families. And I think in this situation, in critical care, it's an end-of-life situation, some for patients, plays a major role, and also like a coping strategy to help them to endure this difficult situation. And I think we need to endorse incorporating spiritual care to have a more holistic, a more integral care to patients. And after all, I think we need to have a more patient-centered care approach to these patients. And I think at the end, this quick guideline perhaps may help, especially the healthcare providers, just to let you know they have some key points: the presence, the comfort. We have many spiritual resources, and I think that's it, because I don't want to create something that it's over, very complicated, because we need to have something that is the essential, the pillars and the foundations of spiritual care to help the professionals. Okay, so thank you so much. I finished my presentation.